with overall respiratory infections, influenza, and COVID-19 activity, really the key messages in terms of what we can do as individuals, what we can do as a community, and what we're focusing on in terms of public health messages continue to be the same thing, because the messages actually work for all of those challenges that we're facing. So number one is to stay home if you're sick, and to wait at least 24 hours until your symptoms have been improving, or it's been 24 hours since your fever's gone away. To wear a mask for 10 days after your symptoms have started. And I know this is the message that in particular, we're not seeing a lot of uptake on. Starting to perhaps see a bit more masking in the community, but I think especially as we're seeing more influenza, masking helps to protect against COVID-19 certainly, but also against influenza and against other respiratory infections. There is simple, easy, effective way to help preventing viruses transmitting from one person to another. If you are high risk of getting a severe illness from COVID-19, I would strongly recommend right now that you be wearing a mask when you're going into indoor public settings. And if you're not at high risk of severe illness, you're certainly still at risk of getting COVID-19 infection and COVID-19 related illness. Certainly in indoor settings that are crowded, I would recommend wearing a mask. And I think as we continue to see activity increase over the next couple of weeks, we'll continue to encourage and put out stronger messaging as it becomes more important to be using this really simple tool that we have to prevent ongoing activity of COVID-19, influenza, and other respiratory viruses.